After you crack your neck, but then within about an hour or so, you got to do it again, there's every possibility that the attachments on our cervical spine of some various neck muscles are dealing with adhesions, which, if taken care of, the need for cracking would go away. The adhesions can be there because of overuse or trauma, as seen in accidents. Now, one of two things is happening when we crack our necks. Either we've actually made an adjustment, but because the imbalance in the muscles is still off, the bone gets pulled out of place within a very short time. The other thing that could happen is that when we get the pop, we actually get an exchange of gas, and that releases a chemical component that goes to the brain to tell the brain to shut off that pain cycle temporarily. But again, the imbalance in the muscles is not taken care of, and therefore, within a very short period, your bone is getting pulled out of place again. Let's take care of those adhesions with our massage gun. We're going to turn on the massage gun to the lowest setting. Use the ball. The reason I'm using the ball is because it's going to have more surface area. I can do it maybe in 3 or 4 times because it's going to cover more area at one time. I want to make sure you find the side of the neck. So place your hand on the side of your neck and really feel for a bit more bony protrusions. Those are the transverse processes of our cervical spine. And this is where we will be. Now we will come from either the front or the back, whether we're coming this way or this way. It doesn't matter, but just be careful not to pinch your skin in here. That can happen. Say I come from the back, I keep my angle between the machine and my neck slightly diagonal, so it doesn't, if I go this way, I'm bound to pinch it. If I go like that, I'm bound to pinch it. But if I go this way slightly, it will not pinch. So I'm going to be on the side of the neck right there, and I'm putting just a tug. Now, I want this to be fairly soft. I'm going to place my neck in a slight flexion to the side. And I'm going to apply a little pressure. This isn't about trying to get the muscle to feel the vibration really deep or anything. We're going after those attachments. So I want to make sure I get nice and low on that neck where it curves down. I want to make sure I get on that C7. So I'm going to get into that C7, stay there for 30 seconds to about a minute even. If it's a really bad problem with your neck, give it a good enough time to make sure that the cross fiber gets done on there long enough. Then I'm going to go up a little bit and make sure I take care of those. And I work my way just like that along the side of the neck. I'm not putting a lot of pressure. When I feel like it's too tender or too sore, I back off because I'm looking for the cross fiber to feel more like a nuisance, not so much pain. To come into the spinous processes, so here's my spinous processes. I'm going to be just to the side of that, so I'm going to be right there, and I'm going to pull a little tug on it, and I'm making sure that I don't feel pain, I feel nuisance. So if it's painful, I back off a little bit, let it just do the back and forth for 30 seconds, making sure that those tendons are getting a good cross fiber on them. Once again, when I get up here by the suboccipitals, I'm going to put about maybe 2 fingers there. I don't want to get any closer than that to my base of the skull because especially not all guns have such a low setting as this guy. This is about 1,000 to 1,100. If those RPMs are higher, you're going to cause more issues down in here than solving problems. So best to stay away from this. Maybe do more manual there if you want with your own fingers as opposed to a massage gun. But keep it safe for your neck. 2 fingers under the base of the skull. That way you get there, you stop, you don't go any higher. Now it's very important to understand that this is not a quick fix. It might take a little bit of time. So during your first week, if you can get on it 3 to 4 times within that week, you're going to see that difference, and soon enough you're going to notice, hey, I don't need to crack the neck. And when I bend to the side or turn to the side, it doesn't really feel the same way. It's less pain, less pulling, less pinching of that nerve.